Good to go. All right. Call this meeting to order of the Town Council Subcommittee on Finance at 5:10. First off, for anybody here in the building, emergency evacuation plan, you can go back out the doors you came in, or you can go to the side doors here and go out the back marked exit. We'll call this meeting to order for attendance tonight. Councilman Dowen.
Here.
And Vice Chair Hool.
Here.
And first item on the agenda is public comment on docketed items. If there's anybody in here or on Zoom who would like to speak, please raise your hand, state your name and address, and proceed. Yep, just come on up. Thank you very much. Just need your name and address for the record, please. Should be green. Yep.
Hi, Sonia Ives, 6 Red Maple Road. I was here at the town council meeting that you had a few weeks ago, and I realized that you guys wanted more time to go over the information. I'm hoping that all of your questions were answered or you had enough time to find them. There were a few things that were mentioned at the meeting that I really wanted to make sure came across clear. I should mention that I'm an SRP member, so I'm a para currently at the high school, and I also have 2 children, one who graduated 2 years ago and one who's a junior at the high school. One thing that was mentioned was like, why was this being discussed now? Which I can understand that being confusing, because when I was the union rep at the building I was at previously, people were asking the same thing. So the reason that this was done at this time as opposed to waiting to the end of the year was because there was an opportunity to save money by switching insurance. But in order to do that, like the short answer, in order to do that, we had to open the contract. So this was like, we'll get this done. It'll make everybody happy. We're saving money. We're doing early negotiations, and then we can move on. We lost out. There were some, I know there are some SRP members that lost benefits through the pharmacy end of our insurance coverage. But we were willing to do that if it meant it was saving money for the district and therefore the town. So I hope that makes sense, that that was the reason. And the reason that we're asking for it to be determined earlier rather than later is because we need to start negotiations if that's not going to be the case. I know also somebody had brought up a good point. They were like, oh, well, shouldn't the top districts in the state be making the most money? And there are a lot of businesses where that makes a lot of sense. But when you stop and think about it, I'm sure everybody realizes there's a lot that goes into educational outcomes that are actually outside of the school's control. You have to look at factors like family structure, family income, family education. I have a sister who lives in Connecticut, and she's in a very wealthy town, and she's constantly amazed at how much families actually support their children's education by paying for outside activities and tutoring. So sometimes those districts where you're seeing these fantastic results, it might seem straightforward that, oh, those teachers are amazing. And I don't doubt that they are, but there's so many other factors that go into it. It's not as easy to just compare that. So I hope that those are things that you'll consider. Inflation right now is still over 2%. And I know the federal government has been working to get that down. But even with that, the 2% is considered the normal amount of increase. And the raises for the SRP, because we have an hourly rate that's already low to begin with, 2% makes sense. The fact that the CTA is willing to take less than what's cost of living at this point is really, I mean, they're just asking to help make ends meet. We all are. I mean, the school committee has been working very hard to try to get the budget, the deficit under control. But I just would hate to see that get balanced by using, the teachers that are there every day educating the kids. So those are just some things I hope you take into consideration when you're talking about this tonight. Thank you very much.
No, absolutely. Thank you for the comments and appreciate the way you put things. There's always the outside influences that are just out of our control, charters, state laws, things like that. So important to keep that stuff in mind. So thank you for your commentary. Anyone else in chambers like to speak? If not, we'll kick it over to Zoom. I think we have a hand raised. Please come on in, state your name and address for the record, and go ahead.
Hi, my name is Tammy Anderson, 5710 Flat River Road, and I am the president of the SRP. I did speak up the last meeting last week and, let you guys all know what the SRP actually does. I forgot to mention at that time that 85% of the SRP live in town and are your constituents. And like I said, our last contract was approved literally at 9 o'clock at night, the night it expired. And it's really no way to treat your constituents. And we are hopeful that this one passes tonight. And we appreciate your time.
Thank you for that. So just to make sure I heard that right, 85% of the members of the SRP in Coventry are also residents. That is
Correct.
something, okay. Well,
Mhm.
interesting point. Something I have not heard before. So thank you very much for that, Mrs.
You're welcome.
Anderson.
You're welcome.
Anyone else? Seeing none in here. Oh, is that same hand? Same hand. All right. Looks like it for public comment. All right. So finish that piece of the agenda. Moving on to new business. We have discussion and review of the school's CTA and SRP contracts. Do we want to start off with Mr. Savetti, or what's the pleasure here?
So it's up to you, Chairman. So Superintendent Cowher is here, Financial Director DeVerne is here. All the documents that were attached at the last meeting were here, along with some additional ones. So if you want the director to start here, and then you can
Yeah.
punch to Don Cowher after that.
Sure, sounds great. Thank you very much. Yeah, just I know you've done some overview. For those out there, one of the reasons we needed some of the time in between was to make sure we all had a chance. Mr. Savetti has sent us a bunch of information in the last few weeks on this. So if you want to give maybe a high level, or we can go over some questions and take it from there.
Good evening. So again, just general comments, right? So with any budget or projection, it's just that, it's a projection. It's hard enough to project where we're going to be in the next 6 months versus looking over the next 5 years, or in this case, 3-year period of the contract. So as you heard at the last meeting and presentation by the school department, there's many estimates, right? There's many assumptions that go into this, and numbers could swing significantly if those assumptions don't come to fruition. So just a couple of examples. In the 5-year projection that the town utilized, we projected a 2.5% increase in the state aid for education. The school's projecting a 3% increase. I can't dispute their projection because we've actually been fortunate, and over the last couple of years, the town's seen an increase of 5% in the state aid. So 3% is conservative, but just so between a 2.5% and a 3% over that 5-year term, that equates to about another $2.4 million. So if we were to come in just that 0.5% lower, it does compound. But again, I have no reason to dispute what the school department's utilizing based on the information they have available. My reasoning for using the 2.5% was just knowing what we're hearing about at the state level. State's facing $120 million deficit. Are we going to continue to see education funding increase? Some of the other estimates that, just looking at in the school department's projection, and I believe they provided additional information to you, they had projected 8 employees per year retiring at the top level and being replaced by a step level 3. In that projection or that assumption, they were also assuming that the healthcare and dental is going to be at a single plan versus a family plan. Obviously, a big difference between those. If you look at it over the 5-year period, you're looking at about another $1.3 million, or $1.4 million. So again, those are all the things you do have to consider. But again, I can't reiterate enough that When I looked at their figures, they had a detailed budget of personnel, which is probably the first time I've seen it since I've been here. So they tried to lay out all the personnel, the positions, not necessarily personnel, but the positions where you had what step they're at, they had the longevity. So it was very detailed projection that they put together. But again, as I started off saying, a projection is just that. It's an estimate of where we think we're going to be. And, ideal world, yeah, we'd love to see 0% in the first year. So you're getting going and that compounds. But, the numbers, the way they have them laid out now, do appear to work. Again, I still stand by my position that I think this can be paid off over the next 3 years. The deficit is what I'm referring to, would be paid off over the next 3 years, utilizing some of the internal service fund revenue to supplement the budget. But again, I'll answer any other questions if you have any, but there's, a number of assumptions. As I said, if you just go line by line, tuition revenues, projected increase 4%, but yet we don't necessarily see a projection in the expense going out. So some of those things, do need to relate, but again, it's just that it's a projection.
Yeah, fully understand that. I mean, it's tough for people to wrap their minds around, especially when you get the numbers this big, that the budget is a guide. We see it every time here with all of our tiny numbers that roll up into the big numbers. And, you have to get comfortable with working with some of the unknown. Just to clarify, so in past times, you may have had a position title, and that was kind of limited on the information. This time around, with the detail in the budget, we're seeing, Joan Smith has a single family plan now, and we know that for sure. It's not a guess.
Correct.
Okay.
Correct. Yeah. Some of the initial budgets, again, prior to Chris being in the role he's in now, the school business manager, we would sit down at budget time, town manager and I looking at the school department budget and some of the benefits in those line items. It was just, well, this is what we budgeted last year. Here's what we're budgeting next year. Never consideration of where the actuals came in at. And I think the, school department's done a lot of work to try to lay out the budget in much more detail, especially the personnel and related benefits, as that's probably, if I had to guess, 85% of their budget, if not, maybe even a little bit more when you factor in retirement and everything. So I think they've put a lot of time into the analysis to make sure they're accounting for every position.
That's definitely promising to hear. I have some questions kind of on the assumptions, but I think that would make more sense for the superintendent or Mr. DeVerna. Either way, again, high-level questions that I just, want a little more information on. Budgets have risk built into them, as you've already alluded to. There's so many unknowns. State funding, federal funding. Certainly we have a ton of development coming in, so you're really taking a snapshot in time and trying to project 5 years. So understanding that is a big piece of this. Do you all have questions for Mr. Savetti? Gotcha.
I think for me, where would, if the state aid were to be reduced to 2.5% versus the assumption to 3%, where would that money come from? And you said it was 2 million, or was it, just want to make sure I have my numbers right, about 2. So what would happen in that case if the state aid did get reduced? If we look at what's happening on the federal level, federal level comes into the state for education, all of that seems to be changing. If this comes in at 2.5%, what happens? Who's responsible for that 2 million? Is it?
Tough to answer entirely, but I guess at the end of the day, what we look at is the school puts together a budget annually that gets presented to the town manager and then to the council, where they include the state aid. So if the state aid were going to come in less than anticipated, they'd have to make the adjustment in their budget. Now, would they be able to make all those cuts, or would they be looking for the town to increase the tax revenue that going to them? That's what have to be explored at that time. But initially, it's the school has to deal with those decreases in revenue. And similar to, I guess, over the past couple of years, at least since I've been here, right, over the last 3 years, I guess 3 years, time flies. Over the last 3 years, the town council passes a budget usually in May, beginning of May. Well, the state aid or the state budget doesn't get approved until June sometimes. each of the last 3 years, we've seen the school department receive more state funding than what was in the original budget. So from, my seat, I always look at that and say, well, if we approved their budget and they were okay with the budget that was approved, why didn't we stay at that budget and the extra state aid would help to build their fund balance? That hasn't been the case. The extra state aid, their budget gets revised, it gets allocated in expenditure, so they're still presenting a balanced budget. So you would have the reverse in that case, right? If the state aid got approved at a lower amount, they'd have to go make the adjustments downward.
Now you made me think of another one then. Would that change in state aid affect maintenance of effort?
To the best of my knowledge, no, it does not. Maintenance of effort is just on the portion, that local
okay.
appropriation.
Makes sense.
So historically, we have seen more than 3% state aid come over. Just want to make sure I'm understanding that correctly.
I could say that for the last 3 years, yes.
But you're being a little more conservative based on what you're hearing from the state level, from the federal level, what you're seeing
Correct.
coming in. I'd like to hear what the school committee would be able to do. As far as, I know that there's some costs and we'll wait for them to get it up here that I've already spoken to Mr. Coward about in the back briefly, but just trying to understand some of the costs that they're facing. And then you tie that in with, because those costs are unknown and it's all unknowns. And it's like, we're doing this now. We haven't seen, I'm here 3 months. I haven't seen a town budget yet. So we're looking at all these things and I'm trying to understand, okay, I see my emails coming over the weekend. We're down 5 DPW trucks, and it's like, okay, where's that $2 million is a lot of money. We could buy a lot of trucks with that. So it's just trying to make sure that what we're doing is actually fiscally responsible, because I like the idea of the numbers, right? The numbers, we know in 1%, 2%, it's, if you look across the state level to what the town of Coventry is asking compared to what their, unions are asking from the state level, we're in a good position. It's just the timing of this is terrible with a lot of unknowns. Just trying to wrap my head
Good
around.
point, Councilman. I think so the 2.5 million is over the 5 years. It's not every year. So it will
Thank
be
you
a
for that.
gradual increase. So I think
It would be over
able-
the 3 years. It'd be over the 3 years of the contract,
3 years of
correct?
the contract, correct.
Okay.
But the 5-year plan, he went.
So $700,000 a year.
No, so year one, the impact's 147,000. Okay, year two would be roughly 303,000. Year four, 467,000. Year five, 639,000, or year four rather, and then year five, 822,000. So the aggregate over that 5-year period, because again, when we first started looking at this, right, we were looking at the 5-year projection and saying, where would they be in 5 years if this plan took place? And what I'm saying is, over that 5-year, if that state aid came in to 0.5% lower than they're projecting, we'd be short 2.4 million, which would still have us in a deficit position, cumulative position.
But I think what you were kind of saying is, it's not like we got to wait for that to happen. We got to get a new look every year. So
Yeah, every year we have the ability to address it in some combination between the school side and the town side to address whatever deficit number that is.
And fortunately or unfortunately, we also roll the dice with what the town gets from the state aid. So, I hate to break it down into buckets, but, if you look at what the school's going to get in revenue, that's subject to 15 different things similarly for the town. So, the town could lose another piece of local aid, or we may get more of it, or distressed community aid came out last year as the first time. So, that's just the budgeting process, unfortunately, is with the unknowns and the timing of them passing a budget after we do. Not great, but why the state does that, yeah. That's a question I've asked for. We actually, as a state,
Can't change ours to line up with
I
theirs.
mean, well, it does. We actually have the same fiscal year. It's just when we pass it. So the state actually passes their current year budget, maybe the last day of that current year, which is it's very, very tough to look at it from your perspective, because it just adds more risk and unknowns. But we all know we're in that same kind of boat of unknowns. But well, I got you. You interested on that internal service fund piece? Is that what was residual in that fund when we made the change in provider? Was that one or is that something else?
No, that's
Okay.
correct. So switching the providers based on the most recent audit, which is being finalized right now, it's showing a surplus of roughly 1.3 million. Now we still have 6 months of claims run out that have to occur, so that could go down slightly. But generally, you see the claims runoff happen within the first 4 months after year end. So I
And
would think
is-
that number's going to be the
Is
final.
the usage of those funds restricted?
It's restricted for healthcare, yes. And that's where with the school personnel, it's part of that plan for health and dental benefits. I believe their copay was 20%. So 20% of that would have to go to reduce the working premiums that's charged to the employees. And then the other 80% is to be utilized by the school department.
Outside of medical?
No, for medical.
Okay, yeah,
It's
yeah.
still restricted.
Still
for-
restricted. Okay,
Yes.
gotcha.
Still restricted for medical.
Alrighty, thank you for that.
Just for the record, if this goes through, year one is roughly an increase from the town side to cover this of 600,000 year one, if I remember correctly.
Yeah, we actually, in the projected budget that we had, we were in agreement with what the, well, those are the.
And that's based on roughly 60 million payroll, 1%.
I believe
Oh,
we,
right.
we had given them a 2%, a projected 2% increase in the town appropriation to the school is what was in my 5-year projection.
The fiscal note for the contracts is in that package. The 2% for the SRP and then the 11752 for the teachers is part of the package.
I see that. I'm just trying to take it from percentages to dollars, just to make it easy.
Yeah, so the local appropriation, current fiscal year, it's at 52,260,000, and next year would be 53,305,000. So approximately a $1.1 million increase.
For year one or over the course of the contract.
Year one.
Thank you. And you said 1 million, a little over 1 million for year one? That's coming from the town side.
All right, thank you, Bob. Let's bring up whoever would like to speak on the school side.
Well, good evening, everyone. I'll go first, and if I get in the weeds with some numbers, I'll have Chris come up and help with that. So I think I wanted to start off with a conversation I've had with a few different people about why now? Why are we doing this now when the contract hasn't expired? And if you circle back to what you just said about healthcare and the money that was sitting in the, the internal service fund and the potential savings in what our premium was going to be for the town, it's actually the root of why we got a grievance from the school department, from the teachers union to start with, because the teachers union contract says we can't change healthcare provisions until the end of a contract cycle, right? The end of their contract cycle is right now, right? Their last year of the contract is 25-26. So if we were going to do it by the way that the contract is written, we'd be negotiating healthcare with them right now and going through the RFP process right now as we get into negotiations with them. The reason why we pushed everything up a year earlier is because we have a complete sense of urgency about our current fiscal situation and our accumulated deficit. And working with the finance director and the town manager, we felt it was imperative that we go out and do the RFP as soon as we possibly could, so we could recognize the savings right away and potential difference in costs in the year that we're in. Also, the savings of the funds that we're not spending out, cost avoidance, and then this reserve account that's sitting there on the side. So all of those things, going back to what Mr. Hool had said when I was here last time about like, what are we getting? What we did is we moved the timeline up a whole year to to expedite the process. It ended up costing us a grievance, which ended up in front of an arbitration situation. But the reality is it worked out for us in the end, because now as we move forward through this deficit reduction, we had the cost avoidance of $1 million. We had a cost savings of $180,000. And we're looking at, once this reserve is available to us because the claims have run out of this internal service fund, that we can then put back towards our deficit pay down. So the timeline of how this all happened and why this is happening in this year versus at the end of the contract is really sits right with us trying to make the healthcare savings a reality as soon as we
Is
possibly
your
could.
legal side aware now not to make those moves inside of a contract? Was the contract piece just missed and that's why we had the grievance?
Well, so what happens is if you ever have the pleasure of looking at our teacher contract, it's a very involved document with lots of reference points that go into many different places. We felt we were in the position to start that process because we were not going to change healthcare in terms of where they get their medical coverage, and we didn't change healthcare in terms of where they're getting their dental coverage. All we changed was the provider or the manager of the pharmaceuticals, because we went over to Caremark from Prime, and Prime is at Blue Cross Blue Shield, and Caremark is part of what trusts use. So we thought we were in the right position because we weren't changing anything. All we were doing is changing the prescription manager.
So it wasn't missed. It was just,
It-
you looked at it.
It was our
You thought you
interpretation.
had it and then they grieved it. I got you. All right. Just being mindful of time because I know we got to reset in here in about 20 minutes. If you wouldn't mind, do you want to just jump into some questions? I just got some high level quick ones. As Mr. Savetti rightly pointed out, these budgets are all based on assumptions. It's I don't want to say a crapshoot. It's more sophisticated than that. But just looking at the revenue side, you have your tuition revenue set to increase 4% annually. If we are getting, that would mean we would be getting 4% more than we're putting out right now.
Yes and no. So it's two different cohorts of kids, right? We have the cohort of kids that live in Coventry whose parents pay taxes in Coventry, who, if they leave and go someplace else, we pay tuition out, right? Because they're going someplace else.
Right.
The tuition in is not that cohort of kids. The tuition in is kids who are from other communities who now see our programs as being attractive and being in line with what they want to do in the future and coming in, and they're sending town paying us a tuition. So it's not a 1-for-1 per se, because the savings on one side is keeping our kids in and not paying out. And on the other side, it's a marketing program to get our kids staying and other kids coming in. And so the tuition has been going up the last few years because our program is robust. Our kids are competitive in Skills USA. They travel and compete nationally, and more kids from neighboring communities have been coming in. And the good news is, actually, looking at our budget this year, more of our kids from Coventry are not going out, which is a good.
Oh, that's good. Now, when I went and attended the walkthrough there, your CTE director noted that, everything is pretty full at capacity. I see that your assumptions don't include additional hirings. How will we, bridge that gap between having more students and not more teachers?
So we have a few different things, getting in the weeds a little bit. So we have our programs, we have our staffing for our programs. Whatever space we have within programs, if it fills up, kids typically choose a choice 1, a choice 2, a choice 3. So there are always programs that they can go into if one of the programs they want is full. And we always give our in-town kids priority over kids coming in because, we want to, tuition coming in is nice, but tuition going out is horrific. And we're too proud to have our kids go into school in another community. So we make our priorities to keep the Coventry kids in Coventry, and then we pull in kids from other communities.
Just reminded me, any progress on your, I think it was a superintendent's group, trying to look at changing those zones and all that? Is that
so
kinda...
we have our own inter-organizational agreement that we're banging out, which essentially is going to say no more acceptances after April 1st. And the benefit of that, and it goes to actually what you guys were saying earlier about our budget passes in May, and then a bunch of things happen after that. Historically, kids who are going to other CTEs, applications come in after our budget's been done. So we budget for kids who are going to neighboring communities. It gets approved by us, it gets approved by you. And then over the summer, 10 more kids say they're going someplace else. That's not in our budget at $17,000 each. So now that's $170,000 that we have to come up with. And to go with what Mr. Savetti was saying earlier, even though state aid comes in after your budget's done, you know, when we have that kind of influx, whether it's a few $100,000s or more, any potential overruns that happen after the budget's been settled, that's where that money gets spent. Whether it's a kid going out of district for DCYF, or us having to pay for kids going to a CTE program, or any additional costs that come up, or if we were in a position where we had to cut programs, then we pull back in.
Right, Councilman Dowan?
You say that there are times when student applications come in after a certain period. Is there a deadline in the state that prevents those sort of
No.
transfers? Or can we have an arrangement
That's
with
what we're
those
doing.
certain districts to prevent that so that we can calculate these?
Yeah,
on our-
so we're doing an interorganizational. So RISA is the Rhode Island Association of School Principals, right? As school superintendents. And the school superintendents all have different budget timelines. They all have different budgetary situations. Foster Gloucester is doing their budget in January. Charahoe is doing theirs in, you know, late May, June. But we all agreed that this hurts us because we're budgeting based on what we know. And when we get surprises over the summer of things that we don't know and can't plan for, it hurts all of us. So we have all sort of agreed loosely, it's not in law. So granted, you know, if somebody wants to go off rogue and do something different, they could. But the reality is we all see the benefit of it. So what we've decided together as a group is that we're going to say applications are due by April 1st, acceptances are done by May 1st, and nothing else happens after that. And if it does, it has to be between the two superintendents and it has to be based on like a specific need versus an open application. I mean, last year I had a student leave our district in January of 25. She was here for the first half of the year and she put an application to go to another district in January and I had to approve it. So I had to pay tuition for 2 quarters, which was about, you know, $8,000.
And do you know off the top how many students we're paying other districts to educate?
I can probably pull it out of my budget. It's going down. I can tell you better in numbers. It's about 2 million and change in tuitions going out. It's about 1 million and change of tuitions coming in. So we're upside down. So our goal, that's going back to Mr. Viducci's question, is to get our kids to stay so that money out the door doesn't go out the door, but also increase the money coming in so that we can right the ship. And because way back in the day, before every school community could do their own CTE programming and the districts had to go to the centers, Coventry had a center. We're a regional center. So we only took tuition in. We never paid out because everybody who wanted to do CTE had to, in this area, had to come to Coventry. That law changed at some point and now kids can go anywhere.
And is that pretty much what everybody's going for, CTE? Because I remember at our joint meeting, you had mentioned that there are a lot of students that are doing it for athletic
Well,
purposes.
yeah, so
but
the
are they
CTE is the
guys at
official
CTE?
thing, right? You can't say, I want to go to another community to play soccer, but
Right.
you can say, I'm going to go to the other community to do biomed and I'm going to play soccer. So you can't go for sports. You can go for CTE. And then once you're at the school, you can do whatever you want. So what kids often do is if they have a coach, like a traveling coach or somebody that they train with, and that coach is a coach in a particular community, the kids all know each other. They're all been on the same team forever. They will put in an application to go to that school so they can play for that coach. And the application will be for some CTE program. I'll be fast because I know you're meeting short. There was a whole situation a few years ago between two communities, and it went to a hearing, and the community that filed the complaint saying that the two programs were substantially similar and the student shouldn't go, actually won the complaint, and the student was told, you can't leave for that program because they're the same, and the student said, that's okay, I'll just do this program. Because it wasn't
That's the
about,
part of the stuff, you know,
It
we're
was
talking
never
about at
about
a
the
state
program.
level, that is.
Students stay in the program or are they switching to just going to regular
So,
school?
so that's part of our due diligence and Chris's team works on that. They make sure the kids are still residents of Coventry, that the kids still go to the program, the kids still attend, because once they leave our roles, we have to keep track of who they are.
Okay, so it sounds like you're doing almost as much as you can. Thanks.
Does it sound right if I said like 120 maybe students going out, just doing the 2 million divided by the
I
17,000?
have it in here. If you give me 2 seconds.
The number is what I was really
Yeah, that, it's just
concerned with. It's not
interesting,
the
yeah.
student numbers, but I mean,
Yeah.
because this came out of the pool of $12 million
I have the number in
that
my,
was paid for services.
yeah, the number is in my computer, so I apologize. It's, we have, I have a summary in our budget. We're still kind of finalizing it, but essentially it doesn't give me the numbers because I didn't put that into it, but we pay out to other CTEs about 1.8 million. We're sending out to charters 707,000. We're spending in special ed placements 2.3 million. We're budgeting for DCYF at 1.5 million for a grand total of $6.3 million of kids going other places. Now, CTE is the only one that's based on choice. Actually, CTE and charter are both based on choice, but special ed is not based on choice, it's based on need. And DCYF is outside our control. The state says that's what's happening, and here's the bill.
Thanks.
One more, a little bit. I just had it in my notes. It's on the expenditure side of the assumptions. It's number 16, other benefits, teachers union. Just curious what those benefits are. They just weren't listed under any, specific category.
Chris, can you speak to the other benefits section? Give us 1 second for that.
While he's looking for that, any movement or any changes in the discussion around healthcare waiver buybacks?
Oh, you talk about for retirees?
That was going to be my other one.
Yeah.
Yeah, but either way.
So the retiree one, that also went to arbitration, just so you know, because I know sometimes people think like, we're like working hand in hand with the union all the time. Like we had 2 arbitrations in 1 year. There hasn't been an arbitration between the school department and the union in years, and we had 2 in 1 year. One had to do with healthcare and the other one had to do with the retiree benefits. The arbitrator said that there is some responsibility for us to be paying what we've been paying, but we need to do a better job in due diligence in verifying who the people are and that they qualify for those payments based on what's in the contract. What's the other one you're talking
Well,
about?
before you go that one, what's the plan to do that?
So Chris's team is working on it with me too. So we have a whole, it's like an affidavit form that goes out to the retirees, and there's a number of questions they have to answer about where they get their health care. Do they have a supplemental plan? All these different questions that are built into the contract, which qualifies somebody for the reimbursement or not. And if they answer the questions in the affirmative, and they have the documentation to show that they paid the money, then they're available for the reimbursement.
Okay, just looking at some questions I got in from some viewers before this. Is that what's considered the healthcare stipend?
No, the healthcare
That's-
stipend is if somebody, and actually I was going to mention this earlier, so I'm glad you brought that up. So one of the things Mr. Zavetti talked about earlier is, when we say somebody's retiring and then we're going to hire somebody in a step 3, we say, well, that person is going to take an individual plan. And he's right. They could turn around and say, actually, I want a healthcare plan that's for my family. Or they could turn around and say, I don't need healthcare at all. My spouse has it. So we get all 3. So sometimes it's none, sometimes it's a single, sometimes it's a family plan. The stipend is connected to that. As an incentive, number of years ago, when people take healthcare someplace else, which brings our healthcare costs down, we have a stipend that people get. It's a few $1,000s, which is far less than even an individual plan costs, to get people to go on their spouse's plan if their spouse has a plan. And actually the number of, and our benefits are good. So that incentive is actually kind of run its course because the number of people actually going to another healthcare plan is less than we've had historically. Do you have the answer to that question, Chris?
Yeah, it's item 16 under the expenditure side of the assumptions.
Item 16, other benefits for the teachers unit. Okay. So a lot of that is it's based on the way they sort of walk you from our UCOA into the Department of Municipal Finance has their grouping in this format for the MTP report. It's basically some miscellaneous things that don't fit into those other categories, but I can get you the detail on it. It's been a while since
Just because I knew they didn't fit in something. Obviously, it's called other. So
right, it doesn't fit into one of
just
the other
interesting
benefit
to know what they
categories.
might be.
But I'd have to get on my computer and I'll be able to drill down. I can send you
Yes, please.
the detail on that.
Thank you. Did you have something?
Just want to
Councilman
follow up on the, I'm assuming you got the same email that I did in regards. So annually for the stipend for the teachers buyback, medical buyback, it's roughly like almost $371,000 a year. Right now, this is not my calculations. I got this email from a constituent, so I'm trying to address his concerns in here as well.
So, Chris, do we have the medical buyback line in the 5-year projection?
Like, is that something, obviously you can't change it, right, for people who were there, but
So
moving forward, these are ways that I would be like, okay, because you just mentioned also that the benefits are good in Coventry, which then was like ding ding. That tells me that potential new hires coming in will want our insurance,
might, yeah.
which may equal family plans. And I'm not saying don't hurt the benefits. That's not.
Right. If they're under 26, our new hires often stay on their family plan with their parents. That's true. We have a number of hires that just stay with their parents till they're
I'm
26.
self-employed. My kids
Yeah.
won't be on mine.
Yeah. So, but that's that's their right legally. So that's what they do. And then sometimes they'll jump over to an individual plan, or if they have a spouse, they'll take a family plan, or they'll choose a different one. The other thing I was going to mention, back to what Chris was saying, the MTP format, we've said that a few times, is what the Auditor General and the Municipal Finance require us to provide in terms of reporting. UCOA, which is what RIDE requires, those two things don't always evenly match up. So the melding of those together sometimes create these lines that say other.
Unfortunately, that makes sense.
Yeah. But I see the number of stipends for healthcare going down.
And then if I could just read one more thing, Mr. Chairman, for the record here from this email that was sent in to me, it states that the student population has decreased each year, but the budget continues to go up. So for example, in 2020 to 2021, the student population was roughly 4,390 students. And he did send a reference with the site. I'm also able to share that if you want. Versus in 2024 to 2025, we were looking at 4,056 students, so roughly 344 students difference. I did brief Mr. Cowart in the back. I just to try to understand it, but just to bring the question forward for the public. So we're seeing a decrease in our students, which is, I'm assuming, affecting the formula from the state level of funding. But it's like our budget is increasing, and I know that inflation can't be the only reason for that. And inflation it hits all of us. We're all facing it.
Mm-hmm.
So can you explain to me where some of these correspondence or correlations would come together between the fact that we're decreasing our student population, but we're increasing what we're paying?
Yeah. So you have to understand, when we see a decrease in student population, whatever, and that is accurate. It's been a 10-year slow reduction. So it wasn't like a 10-year, like down 100, down 100, down 100. It's been a slow reduction, but it's been over 10 years. And in my budget, when I do my presentation, I have an enrollment report that I'll share with you, which shows that we're now kind of steady, we're even. But what happens is that's all students, right, K to 12, across all your schools and across all the programs. And so a lot of times when you see those reductions of enrollment, they don't correlate to a reduction in staff, because it could be 4 12th graders who are all on their own schedule. It could be 3 11th graders, and it could be 2 10th graders and 6 9th graders. And I can just keep going down. And when you add that number up, you can say, why, my goodness, it's gone down by 100 students or 200 students, but that's spread across all the grade levels and all the schools. And so you can't always just say, well, we went down 100 kids, I'm going to get rid of X number of jobs. Or I got this many kids coming in, I have to add this many jobs, because sometimes we can absorb the additions. But I will say, because I did think it's worth mentioning, that in 2023 we had 31 resignations and retirements, but we only had 13 new hires. So those were elimination of positions. In 2024 we had 23 resignations and retirements, and we only had 6 additions. And this is just CTA, this is not SRP. And in 2025 we had 18 resignations and retirements, and we only brought back 7 people. So we've been cutting staff significantly for the last 3 years. It's an average of 24 staff have been cut over the last 3 years, but only 9 hired. And so there's rising costs with inflation. Even the last contract was a contract that was a pretty rich contract, and the teachers have acknowledged that. We've acknowledged that. But the part of the reason was there's a teacher shortage, and we're trying to attract staff to our district because we can't have classrooms without teachers. And that strategy actually worked because we've hired some really great teachers from districts, or some new teachers that came out of college and came straight here. But the reality is we've cut significant number of teachers as well over the last 3 years, and SRP people.
Great point and good time to cut it off because we're up against time. So, looking for someone to just make a motion to refer this back over to our full council, which will be here shortly. I don't think we're referring yes, no, or otherwise. We're just, referring it back. Further discussion. Yeah,
I'll make a motion to send this contract back to the full council.
we have a motion. Do we have a second?
Second.
All right. Any more discussion? All right. All those in favor? Aye. Opposed? Ayes have it. We will end this hearing at 5:55, and we will be back in a few minutes for the full council meeting. Thanks.